Everybody out there. This is Morgan Denny reporting live from the basement in Portland, Oregon. I hope you guys are all having a good day so far, since hopefully it's just beginning. This morning, I wanted to talk a little bit about context of patient care within the context of an eval situation and patient setting. Having a student right now brings up a lot of really good questions and some ideas that I think as clinicians I'm back. Oh, great. It brings up a lot of questions in mind that as clinicians, when we've been out of school for a while, we kind of take for granted because we work these ideas seamlessly into our patient care, but that it's important to kind of bring up and look at and rearrange because it will really help our evaluation skills and help our patients to kind of understand what's happening from an effective and efficient position in the room to kind of make us flow along a little faster. So what do I mean by context? Basically, I'm talking about the idea of a situation of the injury that a patient comes in with. So not everyone actually has this, right? Some patients come in and they've got pain somewhere and it happens all the time and they have no idea why and it's been long-term, right? So we know things like chronic pain can create a more regional pain syndrome or not have something specific. But a lot of patients come in with a context, an injury, a movement that created a stress at certain tissues. And so it's important for us to keep that in mind and start to really be more specific about how we test that person and how we kind of look at their injury and what it's done in an affected tissue. Let me give you an example. We had a patient come in the other day who was roller skating with her granddaughter, awesome, cute, adorable, and had a slight fall, she would say, and maybe not a real fall. Reached out, horizontally abducted her shoulder, good morning, Lisa, and caught a railing. So she basically had a very quick stretch of her arm and shoulder. Now, when she came in, she had some sternoclavicular joint pain, she had some AC joint pain, some anterior shoulder pain, some numbness and tingling down into her arm and hand, and some neck pain. Now, out of context, this looks like a crazy injury that has lots of different pieces and parts involved. But when we took it in context and when our testing showed that yes, she had a sprain strain of her SC joint, her glenohumeral joint, and she had a lot of nervous tissue involvement, it makes sense, right? She had a quick, almost uncontrolled movement out to the side. Tissues got stressed, sprained, strained, and now she's got an irritation of those things. Luckily for us, she came in a couple weeks after the injury initially occurred. And so at that point, she was already getting better and able to report that. So this is one of those things where context provides us with the idea that the patient's injury makes sense within the context of their injury. And then additionally, that they're already getting better. So we don't have to go in and create a lot of inflammation. We don't have to go in and stimulate a lot of tissue. We just have to support the system, help the patient to heal a little bit more effectively, and also just allow for that to continue and not kind of get stuck, which it does with some people. The timing of an injury can be super important. So like with this patient I was talking about, it was a fairly acute injury. It fit into the context and they were doing well. We all know that with chronic pain stuff, this doesn't always happen, right? People can come in with more regional pain syndromes. Things don't fit into the boxes nicely. But understanding that it doesn't fit into the box, that it doesn't match the context of their injury is also really important so that we can start identifying some of those central sensitization processes, right? So that we can see that this patient doesn't fit and we can move into a different kind of realm of treatment, right? So another example where this was more apparent was we had a patient come in who was 2 months status post, a pretty terrible quad contusion. Had been at a garage sale and was trying to move a really heavy piece of furniture that had fallen on her leg. Hadn't walked in 2 months. And I know a lot of you are thinking, well, it's just a contusion. But the problem was she had a high level of pain and no explanation for the cause of symptoms. Like her injury fit within the context, but in terms of a time frame, it didn't fit within the context. So she's someone where we're thinking more towards that development of chronic pain or that there's something underlying. So after doing the eval and finding that she literally had a really bad quad contusion and that nothing was truly injured or permanently injured, I should say, she was actually, with a little coaxing, able to walk, able to do everything just fine within about a week. So just keeping that in context, right, and making sure we understand what's going on is super important from a timing perspective. Now, we can also have patients that develop certain problems because of a semi-chronic issue. So a week ago, we had a patient come in who had been hit by a fairly good-sized rock in the thumb, like right in his thenar eminence. This had happened 6 months ago, but because of this ongoing injury where he had had some swelling and hypertonicity of all the muscle groups in his thenar eminence, he had actually developed some ligamentous instability around his CMC and his CMP in his thumb. So looking at that and knowing that context, when he first came in, he looked a little bit more like he might have some of the chronic pain factors developing. But within the context of looking at our tests and measures and finding that he had some hypertonicity in those muscles, and that could actually explain some of the ligamentous instability in his thumb and some of the pain points he was having, it makes sense, right? So if we can put this in context, it makes us better able to explain not only to ourselves but to our patients what's going on with their body and some of the changes that can occur over that time after they've developed their injury. So we have to keep context in mind. That way we understand like where patients are in terms of that pain pattern. Like, do they fit more into the biomechanical sense, or do they fit more into the chronic pain side of things? Or is there something underlying that we have to be more aware of, right? So given that context really can help us develop our spidey sense. Knowing if patients fit into the context is important, because when they don't, that means we have to dig down other channels, right? We have to go be detective, Sherlock Holmes it, to the end until we figure out what's happening with that patient. For example, had a patient come in who was around my age, like 35-ish. I'm not 35, I'm 37 now. Anyhow, who came in and he reported bilateral knee and ankle pain that was pretty severe. Like, this guy looked like an old man when he stood up and walked. The only thing that had happened for him is that he had a really, really great night shacking up with his lady. I am not kidding. That was the only thing he could report that had changed. So knowing that that was a piece of the puzzle, knowing that that was the thing that had changed, didn't explain his symptoms. You go through your tests and measures, and when nothing fits into the box at hand, that's when a patient probably isn't for PT. He actually ended up having like an autoimmune response to gluten. He wasn't truly celiac, but something along that line. But his symptoms resolved pretty easily with change in diet. But that's where you look at the context of the situation and understand that things don't make sense, and then get that person to someone that's a provider that can actually help them in the way that they need, right? So if we're developing that contextual spidey sense, then we understand when things do and don't make sense. Another example is we had a patient come in yesterday who reported neck pain while doing the breaststroke in the pool. No other time frame, only when swimming, only when completing the breaststroke. What a perfect biomechanical case to look at. So that's a patient where we have to look at the movement. We have to be able to dissect what that patient is doing and think about it within the context of swimming, right? What do you need to get your head out of the pool to breathe while you're swimming, completing breaststroke in the pool? Obviously, we need cervical extension, which is kind of the problem, but also we need thoracic extension, lumbar extension, enough scapular retraction and muscular sense in that way to kind of get the lift to bring the head out of the pool to breathe. If we can look at those things and understand the situation and the context we're working in and the key things that the patient needs, it's easier to drive down that rabbit hole of evaluation. Like, we didn't have to go through and do a full upper quadrant screen. We didn't really need to go through and check every little box in the special tests area. All we needed to do or look at the components of what that patient needed to move and screen out what he did and didn't have, right? The context of the situation taught us that we needed A, B, and C, and when we're missing B and C, then of course A is going to be affected, right? So having that context in mind was a key component for this patient. So we need to be putting things in context, not only so we understand if a patient's symptoms make sense, but also to really be more effective and efficient in evals. When I was in school, if you had a knee patient come in or a patient that had knee problems, if you also looked at the ankle and the hip, you were brilliant. You were far ahead of your time. Now in school, students are learning that they need to do a quadrant screen with every injury that comes in. So if I come in and I fell on my elbow, that person is taught, like students are taught that we need to do an upper quadrant screen for that injury. But I would argue that with cases that are straightforward, if someone has hit their finger with a hammer, you don't need to check their cervical spine in order to screen out that there's neck involvement, because there's a clear injury. The context teaches us that it is happening at the finger because there's a direct cause and effect, and we don't need to spend the 10 minutes doing a cervical eval on a finger patient. So it can help you as a student or as a new clinician be a lot more efficient in terms of what you're looking at and how many tests and measures you're completing, if you can take the context in mind and just see if things make sense and where they fit into that context. Because if they easily make sense and they fit in, you don't always have to do 1,000 different tests and measures, right? So guys, the take home from today is just remember to keep your context in mind. If a patient's presentation fits and makes sense from a biomechanical standpoint, then that's great. Like biomechanics are something that our profession has gotten away from a lot, and it has stopped focusing on. And that's actually pretty great because it brings in a whole lot of different things that we've been not only not focusing on, but not paying attention to as a profession for a long time, and those are important. But biomechanics are just anatomy and physics, and both those things are very real. So when they make sense, use them, absolutely use them. So we're going to take context into effect in this situation, not only to make sure a person's injury and the stress of the tissues make sense, but also to make sure it fits into that context so that if we need to send them out, if we need to make sure this person's getting the care they need, we can do that. And also to really make us more efficient as practitioners. So keep that in mind, guys. Context is everything. Backed by popular demand, the song of today is called Powerful Stuff by Sean Hayes. If you're on Facebook, I'll post a link below. Also, guys, keep in mind that we have some great courses coming up, the best of which, and the most exciting in my opinion, is going to be the Sampler in Vegas in April 7th through 8th. So if you're not signed up, guys, that's going to be a good time. Otherwise, have a really fantastic Tuesday, and I'll see you all later.